Warning: watch this video or you will regret it. Have you ever felt your mouth dry and uncomfortable even though you just drank water? Or when talking or eating, do you feel like your mouth lacks moisture, is chapped and uncomfortable? That is a sign of dry mouth syndrome, a seemingly small problem, but can greatly affect your health and daily activities. Many people often ignore this phenomenon because they think it is not serious. But in fact, prolonged dry mouth can cause unpredictable consequences, from tooth decay, gingivitis, to affecting the ability to eat and communicate. In this video, we will learn more about this syndrome, its causes, consequences, as well as effective prevention and treatment methods. Let's explore together so as not to miss an important health sign, helping you and your loved ones live healthier every day. What is dry mouth syndrome? Dry mouth syndrome, also known as xerostomia, is a condition in which the salivary glands do not produce enough saliva to keep the mouth moist and protected. Saliva plays an extremely important role, not only soothing and moisturizing the oral mucosa, but also helping to neutralize acids, protect tooth enamel from cavities, and limit bacterial growth. Saliva also aids in the initial digestive process by making it easier to chew and swallow food. When the salivary glands do not function effectively, the mouth will become dry, causing discomfort, cracking, burning, and even changes in taste. People with dry mouth often have difficulty talking, eating, and even sleep is affected by the feeling of dryness and discomfort. The causes of dry mouth syndrome are varied. Some common medications, such as antidepressants, antihistamines, blood pressure medications, and diabetes medications can reduce saliva production. In addition, diseases such as diabetes, thyroid disease, inflammation of the salivary glands, or autoimmune diseases such as Sjogren's syndrome can also lead to this condition. Age is also a factor that cannot be ignored. As we age, the ability to secrete saliva gradually decreases, increasing the risk of dry mouth. The habit of smoking, drinking alcohol, consuming a lot of alcoholic beverages or caffeine also contributes to making the mouth dry faster. In general, dry mouth is not just a temporary symptom, but a warning sign that there is a problem with oral health, which needs to be cared for and treated properly to avoid serious consequences in the long term. The major consequences of dry mouth syndrome. Dry mouth syndrome seems to be just a simple discomfort, but if it lasts and is not treated properly, it will cause many serious consequences for oral health and daily life. First, when there is not enough saliva, bacteria in the oral cavity will grow stronger. Saliva has the role of neutralizing acids and cleaning plaque on teeth. Lacking this natural protection layer, teeth are susceptible to cavities. Tooth enamel is damaged, leading to gingivitis and gum disease. People with dry mouth are also susceptible to bad breath due to uncontrolled bacterial growth. Not only affecting the teeth and mouth, dry mouth also makes it difficult to eat and drink. Dry mouth does not lubricate food enough, making the chewing and swallowing process difficult, especially with dry, hard, or spicy foods. This can affect taste and cause the patient to lose appetite, leading to malnutrition. Dry mouth can also make it difficult to speak, affect social interactions, and reduce self-confidence. In the elderly, difficulty swallowing also increases the risk of respiratory diseases due to food or saliva being inhaled into the lungs, causing aspiration pneumonia. If not detected and treated promptly, dry mouth syndrome can lead to a series of complex complications, deeply affecting the quality of life and overall health. How to prevent and improve dry mouth syndrome. Fortunately, dry mouth syndrome can be prevented and improved effectively if you know how to take care of it properly. First, maintaining the habit of drinking enough water every day is extremely important. Water helps keep the oral mucosa moist, supporting the normal functioning of the salivary glands. In addition, limit the use of alcoholic beverages, caffeine, and avoid smoking, factors that reduce saliva secretion and cause dry mouth faster. When taking medication, if you suspect that the medication you are taking is causing dry mouth, talk to your doctor for advice on adjusting or using additional supportive measures. Keeping your mouth clean by brushing your teeth at least twice a day, flossing and using the right mouthwash also helps reduce bacteria and prevent gum disease. Products such as sugar-free gum or artificial saliva can be used to stimulate salivary glands, reducing the feeling of dryness and discomfort. If dry mouth persists or affects your daily life, you should see a dentist or an internist for an accurate diagnosis and proper treatment. Don't let this minor condition become the cause of major consequences. Advice for people with dry mouth syndrome. If you or a loved one is experiencing dry mouth, don't worry too much, because there are many simple and effective ways to improve this condition every day. First of all, make it a habit to drink water regularly. Divide it into small sips instead of drinking a lot at once. Drinking water regularly not only soothes the mouth, but also stimulates the salivary glands to work. In addition, you should avoid using stimulating foods and drinks such as coffee, alcohol, spicy foods, or overly salty foods, because they can make the mouth even drier. The habit of smoking should also be completely eliminated because cigarette smoke greatly affects the quality of saliva and oral health. In addition, don't forget to maintain proper oral hygiene. Use fluoride toothpaste, floss, and mild, alcohol-free mouthwash. This helps prevent tooth decay and gingivitis, two common problems with dry mouth. If dry mouth affects your daily life, you can consider artificial saliva products or sugar-free chewing gum to stimulate saliva production. However, you should consult your doctor or dentist before using these products to ensure safety. Finally, if the condition persists or is accompanied by other symptoms such as pain, inflammation, difficulty swallowing, take the initiative to see a doctor for an accurate diagnosis and timely treatment. Proper care and attention will not only help you improve dry mouth, but also protect your overall oral health and improve your quality of life. Dry mouth is a seemingly minor health problem, but in fact, it can cause many serious consequences if ignored. Early recognition of dry mouth signs and taking preventive measures and proper care will help you maintain oral health and improve your quality of life. Always listen to your body, pay attention to even the smallest changes, and do not hesitate to seek medical help when necessary, because a healthy mouth is the first step to a healthy body and a more fulfilling life.